Good day, my dear friends. I'm Dr. Osama Ibrahim from Easy and Different Radiology. Today, my presentation is gonna be short and sweet. Actually, today I am talking about step 9 from our MRI learning, as we started from 1 to 9. Today, I will talking about restricted diffusion in the brain as diffusion weighted image and ADC map MRI sequence to give signals which discriminating the intracranial space occupying lesion as part 1 from the diffusion weighted image learning MRI sequence. Actually, I have 3 parts from diffusion weighted image presentations. Today I will talk about the part 1. I will talk on these presentations about 7 different cases at the end of the presentations to confirm our understanding the presentations and our concept. And also I have at the end of the presentation surprising map to discriminating lesions from each other according to diffusion weighted image. So let's get started. The learning objective from my presentations, I will answer the 4 questions. The first one is what is the meaning of restricted diffusion? The second question is how can use this diffusion weighted image MRI signals in practical cases? How can you use this? And the third and most important question is what is the differential diagnosis of intracranial space occupying lesions which have restricted diffusions, and how to remember these differential diagnosis by mnemonic word. The last question is how to discriminate these differential diagnoses from each other according to the solution map, which I introduce it in the end of the presentation. Just follow me with a little bit concentration till the end of video and try to do it yourself through different 7 cases. So let's do it. The first question is what is the radiological meaning of the restricted diffusions? I don't talk here about the physical meaning. I talk only from the radiological overview. The meaning of restricted diffusions is high signal in diffusion weighted image, MRI sequence, and low signal in ADC. And meaning both should be present in the case. High signal in diffusions and low signal in ADC. Like this image, which is showing diffusion weighted image and ADC map. ADC map, it looks like map like this. And I have presentations to discriminate signal from each other and sequence from each other. This is a diffusion weighted image and this is the ADC map. If you look for that regions, you have high signal in the diffusion weighted image, which is abnormal signal, and the same area in the consistent area in the ADC showing low signal. So high signal in diffusion and low signal in ADC, this meaning what? Meaning restricted diffusion. And this is the main issue from my presentation today. I'm talking about the restricted diffusion signal. If I find this restricted diffusion signal in the case, MRI case, what is the rule of this finding to discriminate the lesions and what is the discriminating differential diagnosis? As intracranial space occupying lesions, part 1 from the that signal. So the next question is how can you use these diffusion weighted image MRI signals in practical cases? This is questions for me and I will answer for these questions. By this I can use diffusion restricted image in the intracranial space occupying lesions, and I will talk in this as a main discussion part on these presentations as a part 1 from DWI or diffusion weighted image. The second use as a practical for this restricted diffusion signal to discriminate causes and differential diagnosis of gyriform restricted diffusion in adult. And this I will talk it in details in the next presentations, part 2 diffusion weighted image. It can use also the restricted diffusion signal in the other use in the pathological abdominal lesions to confirm malignancy in the particular situations like hepatic metastasis. And this will be discussed in separate presentations as part 3 from DWI. Also, I will promise to make this in the near future. So, how can you use this diffusion weighted image MRI signal in practical cases? This is the second question. This is the example for the 3 situations which I will talk about the restricted diffusion. If you look here, this is a diffusion. The first row is representing diffusion weighted image sequence, MRI sequence, and the second row is representing ADC map. I presented here with high signal in diffusions at that region, which also consistent with low signal in ADC map in the same patient at in the same area. And this one, which is I will talk in that presentations about this part from the diffusion rule of the diffusion weighted image in the diagnosis, and this part representing intracranial space occupying lesions recognitions. The second part is this one, which is showing a high signal also in diffusion and the low signal in ADC map. So this is restricted diffusion, however, in the gyriform pattern or gyriform restricted diffusion in adult, and I will talk this in the next presentations for MRI learning in details and differential diagnosis also. The third practical use for the diffusion restriction signal, which appearing high signal in diffusion weighted image and low signal in ADC map, can be used in the pathological lesions in the abdomen, mainly malignant or neoplastic lesions, and it used in metastasis for the liver, for example. So these lesions is representing acute stroke, and I will talk in details what is the differential diagnosis of other differential diagnosis for that signal as intracranial space occupying lesions in these presentations in next slides. And this one is herpes simplex virus encephalopathy, which affecting the temporal lobe, medial and lateral aspect, as we'll see here, and taking mainly the gyriform pattern. And I will talk also in the other differential diagnosis in the next presentations as MRI learning. And this one representing two lesions in the liver which have high signal in diffusion weighted image and the low signal in the ADC, and so this is representing restricted diffusions, and this was a hepatocellular carcinoma case, and also I will discuss this in details in separate presentations after I finish the first and second part of the diffusion weighted image restricted diffusion signal. So now we can shift to the third question, which is the main part and the main topics for my presentation today, is what is the differential diagnosis of intracranial space occupying lesion which have restricted diffusion signal, as we'll discuss as I discussed already in the previous two slides, and how to remember the differential diagnosis mnemonic word. If I find the restricted diffusion signal, high signal in diffusion weighted image and low signal in ADC map, in the brain, and these lesions looks like space occupying lesion, the mnemonic word to remember the differential diagnosis is seal. What is the meaning of seal? Seal, this is a mnemonic word. Every letter here is representing one pathology which can cause restricted diffusion. And the seal here is from the stroke or acute stroke, E from the epidermoid cyst, A from the abscess, L from the lymphoma. So this is four lesions can occur intracranially and can resembling space occupying lesions, and all of them have restricted diffusion signal. What is the meaning of restricted diffusion? High signal in the diffusion weighted image and low signal in the ADC map. Seal, stroke, epidermoid cyst, abscess, and lymphoma are the mnemonic word to remember the causes which can cause restricted diffusion as intracranial space occupying lesion. Now my presentation is finished, but as I usually use disease practice for the cases to confirm the understanding the presentations. I will use today 7 different cases, and the questions which should be answered today is there restricted diffusion signal, what is the meaning, high C diffusion and low ADC map, and which one from the differential diagnosis list, seal, according the clinical presentations and other MRI sequence to reach which one from the 4 causes of intracranial space occupying lesions which have diffusion weighted image. To get benefits from that presentation, you should or you try to answer these questions, these 2 questions, to discriminate there are restricted diffusion or not, and to reach for one from the other according to clinical and other MRI sequence within 10 seconds, and I will make timers also for that for every case. Okay, so let's get started. Well, Case 1, this is 58 years male, sudden onset of left-sided weakness and facial deviation. And this sequence is a diffusion weighted image, and this one is the ADC map. I will give you 10 seconds to answer the previous questions as I will talk before. Okay, now this is a diffusion, have high signal in the rosette regions, which is representing the parieto-occipital regions or high parietal region, which also showing low signal in ADC map. So high parietal, high signal diffusion weighted image, low signal in ADC map. Is there are any restricted diffusion in this case? Yes, there are restricted diffusion because high diffusion and low ADC map. So now we should help by other clinical data like sudden onset and also the distribution of the lesions along the territory of vessels, and also other MRI sequence or other studies patient did, like this CT, which is showing a high dense area as the CT, non-enhanced CT, and also this is flare image. Flare image is showing also high signal at the same regions of the high parietal. So by these clinical data and by these helping other MRI sequences or studies, we can diagnose the case as acute stroke. And remember the seal word, the seal is from stroke can be taken as a first word for the diagnosis of the restricted diffusions intracranial. Acute stroke is the most common cause for the restricted diffusion in the intracranial brain. However, you should remember seal, there are other causes can cause this restricted diffusion. Case 2, asymptomatic patient, and there are two MRI sequence. I will start the timer. Is there are any restricted diffusion here? Yes, there are, because this is a diffusion weighted image which is showing a high signal in diffusion and low signal in the ADC. So there are restricted diffusions at the cerebellopontine ankle lesion. Cerebellopontine ankle lesions here, this is the most common site for the cysts like epidermoids or arachnoids or the other schwannomas or meningioma. So now, if there are restricted diffusion, so I dealing with the seal and patient asymptomatic. I will help it by the clinical presentations, and also this is a high flare image which appearing, this is appeared slightly hard or high or heterogeneous flare signal, and also this signal in the contrast enhancing appearing non-enhancing lesions, and the non-enhancing lesions in the T1 post-contrast study representing that lesion is a cyst which have restricted diffusion, and so the diagnosis of epidermoid cyst from seal is highly suggestive in this patient. Okay, this is the second case, also patient presented asymptomatic. Is there any restricted diffusion in this patient? Actually, this one is a diffusion weighted image, and this one is the ADC map. So if I look for the lesions at the cerebellopontine angle lesion, like the same site like the previous case, however the signal is different here because the diffusion weighted image showing low signal in the diffusion weighted image, however the ADC map showing a high signal. So low signal in diffusion weighted image meaning there are no restricted diffusion, so this is not the epidermoid cyst. And also contrast study confirm non-enhancing of the lesion, and also this is high signal in the T2. So there are high signal in T2 and no restricted diffusion at the cerebellopontine angle. So this is characteristic for the arachnoid cyst signal. So the arachnoid cyst is the most common differential diagnosis for the epidermoid cyst, can be differentiated by this sequence, which is the diffusion weighted image. If there are restricted diffusion, it is epidermoid. However, if there are no restricted diffusion as that case in that slide, so this is the arachnoid cyst, representing arachnoid cyst. Okay, next case, is there are any restricted diffusion in the image or not? Okay, I presented with 40 years male patient with mild ataxia and homonymous myopia, and this is a diffusion weighted image and ADC map. There are high signal in diffusion weighted image in the left occipital loop and intracranial or intraaxial lesions, and also which is showing the low signal in ADC. There are edema surrounding the lesions, and is this sufficient to to tell that this is a restricted diffusion signal? Yes, this is a restricted diffusion signal because high signal diffusion, low signal ADC. What about the contrast? The contrast study T1 weighted with contrast showing a marginal enhancement of that lesions and also surrounding edema appearing low signal. So there are marginal enhancement of the lesions which is showing restricted diffusion. If I return it to the seal uh, can uh, uh, can choose abscess as a differential diagnosis easily due to this marginal enhancement with restricted diffusion. And this image actually is the ADC map after 4 days from drainage of the abscess, now showing no low signal as that ADC map which done in the previous study with abscess presence. So abscess showing restricted diffusion with low signal in ADC map, and the absence of that signal or now no low signal in ADC map confirm drainage of the abscess. Next case. Okay, first of all, you should discriminate the signal from each other to solve the problem. First, this is a diffusion weighted image. Why? Because hazy image. However, this one is a flare because the image is not hazy and there are separation of fat, and also the white matter is slightly darker than the gray matters. And I have presentations talking in details about how to discriminate signal from each other. And this one is a contrast study because the artery here appeared or the vessels appeared opacified. So what is the signal here? The diffusion showing high signal in diffusion weighted image, and the contrast showing homogeneous enhancement of the lesions. As we see here in the T1, the lesions should be appeared low signal. So if it is appeared homogeneously enhancing like this, so it is due to the contrast. And the FLAIR image showing also the high signal of the lesions at the same region in that right basal ganglia, caudate nucleus and lentiform, between caudate and lentiform nucleus in the deep parietal lobe. So now we have this restricted diffusion which showing homogeneous enhancement in that patient which have 40-year male with left leg weakness for 1 year. So there are no acute onset. The diagnosis here, according to the mnemonic word seal, can be easily diagnosed as a lymphoma because lymphoma preferred the central locations and also showing restricted diffusion and homogeneous enhancement, all the features together, and 1 year weakness. So all the features together are consistent for the diagnosis of the constellation finding here of the lymphoma. Now case 6 this one and case 7 this one, and I will start because we have started by contrast enhancing sequence, MRI sequence. This is T1 with MRI sequence, and this is T1 also. Okay, this is a T1 contrast showing marginal enhancement of the lesions and surrounding edema. And also this is a T1 which is showing marginal enhancement of the lesions with surrounding edema. Actually, until now, these are two different patients. One of them are abscess, and the other one is the glioblastoma multiforme. So we can differentiate the lesions from each other in that sequence of MRI post-contrast. However, diffusion weighted image can help us in the differentiations. As we see here, the diffusion weighted image for that patient showing high signal in diffusion, and this is representing restricted diffusion. However, in the other patient, there are no restricted diffusion of the lesions, and now can easily diagnose the abscess from the glioblastoma multiformis as abscess part from seal, mnemonic word, and stroke and epidermoid cyst, abscess and lymphoma can cause intracranial space occupying lesions and restricted diffusion. However, the glioblastoma multiformes can cause the marginal enhancement in post-contrast study. However, there are no restricted diffusion, as we'll see in that interesting case. And also, this is one slide which is showing the rule of differential diffusion weighted image in differentiating abscess from glioblastoma multiformes. Now the summary. Don't forget the seal mnemonic word for differential diagnosis of intracranial space occupying lesion, and the seal represented stroke, E from epidermoid cyst, A from abscess, and L from lymphoma. And the solution map, I will discuss it with you. First of all, look at the restricted diffusion. If there are restricted diffusion like this, high signal in diffusion weighted image and low signal in ADC map, so you see as a differential diagnosis, mnemonic word, stroke, epidermoid, abscess, and lymphoma. And this is the answer of the question 4 in the learning objective. How can discriminate these causes from each other as a next? Acute status of a patient representing acute stroke. So acute status is very important. The clinical presentation of the patient is very important to exclude the acute stroke from the four causes of the restricted diffusion as intracranial space occupying lesion. Then look at the pattern of contrast enhancement, which can helping us in the differential diagnosis. As we see here, if there are no contrast enhancement at all, so this is representing as that lesions which is showing no contrast enhancement, so it is representing epidermoid cyst. However, if there are a marginal enhancement, as we see here, the marginal enhancement with diffusion restriction is representing an abscess. However, if the enhancement is homogeneous and the central locations like this, the homogeneous enhancement with restricted diffusions is representing the lymphoma. I hope I provide you with a clear knowledge about MRI signal and diffusion restriction weighted image rule in the and the diffusion restrictions also in the intracranial space occupying lesions differential diagnosis. That is all thing about that. And if you like the video, don't forget to subscribe, like, and share to receive any new videos like this in the near futures. And don't forget Wednesday for MRI learning, Sunday for anatomic rapid review, and Friday for Arabic presentations. Have a nice day and thank you.